Good afternoon, everybody. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage, specifically due to UVA and UVB rays, which makes skin more prone to wrinkles, melasma, and skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to surveys, 67% of people in India are not using sunscreen as daily skincare routine. Several things about sunscreen that we people are not aware of, and that makes us to not include sunscreen as an integral part of our skincare routine. So to keep you informed today, we are here to know about sunscreen and skincare regimen. So let's connect today with our skin expert, Dr. Namrata Dosapaty Thaker, live from Ahmedabad. She is a private practitioner at Swastik Skin Clinic at Maninagar and also at Navranpura, Ahmedabad. Dr. Namrata is a consultant dermatologist and cosmetologist from Ahmedabad. She is a young, vibrant, and highly skilled in the field of dermatology. She has completed her MBBS from Srimati NHL Municipal Medical College, Gujarat University, and post-graduation from Civil Hospital Saurashtra University. She has also done fellowship in lasers and aesthetics. She has been a speaker and performed demos in various education, CMEs, and health awareness programs. Today, Dr. Namrata will share with us on sunscreen and skin care routine. A very warm welcome to you, Dr. Namrata. It's a pleasure to have you with us.
Hello everybody. It's a pleasant afternoon today, so hope we'll look forward to a good interaction. A request to pour in some questions.
Exactly. We are looking forward to a very informative, very gainful, fruitful session. And as today, Dr. Namrata, we are going to talk about the importance or significance of sunscreen. The very first question that I want to ask you, and almost everybody asks this, I'm sure you must have faced it n number of times. Why it's important to wear sunscreen every day, daily? Why?
So yes, this is the perfect season to ask this question because most of my patients would be like, "Abhi to dhoop nahi hai, why to wear the sunscreen? Abhi to dhoop bhi nahi hai, बारिश ही बारिश है." But I tell, आपको दिख रहा है, light है, यानी rays है. So rays are not visible. Sun is of course it goes behind the clouds and we see that there's no sun, but the rays of course can penetrate to the clouds. So be it be any season, we have to apply sunscreen because the rays are present everywhere, especially the UVA and UVB rays. UVC rays, because of the ozone depletion, nowadays we are facing the dangers of UVC rays also, which was not earlier present. It couldn't pass through the ozone layer. But since our environment is changing, the UVC rays are also now entering into Earth's atmosphere. So to prevent skin for further damage of the sun, which is like, as you had already said, like premature aging, wrinkles, skin cancer, phototanning, everything can be prevented just from a single use and proper use of a good sunscreen. So if you don't want to invest further into taking treatments for pigmentation and aging and all, the first key for anti-aging and pigment removal would be sunscreen.
Okay, so sunscreen is something that's going to, in long run, going to save us from all the extra investment that we will end up making in skincare rectification. So rather than reaching there, start using sunscreen right away.
Yes, prevention is better than cure, I always say.
Exactly. We completely agree with you on that, doctor. Now, doctor, whenever we go buying a sunscreen, there's a term, an abbreviation rather, SPF. Now, most of us are not aware of it, what it is, how to determine the, perfect or suitable SPF as per our skin or as per the conditions we are into. Please shed some light over it.
Yeah, so SPF, like most of the patients will be, I'm already using an SPF, but selecting the right SPF according to your occupation is right. So what is SPF? It is sun protection factor. So sun protection factor is like a terminology which explains how much of UVB rays. So there are three kind of rays as we discussed: UVA, UVB, and UVC. Of which UVA and UVB causes all these photo aging, skin cancer, photo tanning, everything. So we need protection from UVA as well as UVB rays. So SPF only takes care of the UVB part, not the UVA part. So how much of UVB rays would be filtered from your sunscreen, and you will be protected for how long? Like if you didn't wear your sunscreen and if you wore your sunscreen comes to PS was like 15, 30, 50. So according to your occupation, like if you're just indoors, you can start with just basic 15 SPF. If you are somebody who just commutes to work and then have to stay indoors, is that with 30 SPF. And for those who have field work, those who are like architects or are into like field work continuously throughout the day, I advise, or those who are undergoing procedures like CO2 lasers or chemical peeling or laser toning, I advise them to use SPF 50 or higher.
Okay, so now at least we understand what's SPF, it's sun protected factor, and as per our working conditions, occupations, etc., we can decide on the SPF level. Now, doctor, you said that many times these days, because it's the monsoon time and sun is hardly visible, so people assume that okay, even if we are going out, no need of wearing sunscreen. But you clarify the fact over that. Now, the thing is, people who are inside, you just mentioned that even if you are inside working from your home or inside your home or office, etc., you need to wear SPF of at least 15 SPF, sunscreen of 15 SPF. Now, my question is, why it's that even if we are indoors, we need to wear sunscreen on a daily basis because we are not that much exposed to sun then?
Yeah, so coming to like we'll divide your males and females. Most of like those who are housewives go out to at least do some part of their household chores during the day. So there's some amount of sun exposure, though not physically outside, but yes, through their balconies, through their windows. So you do get rays from them. And plus, if they are into like present into lights, which are the tube lights, they also emit rays. So if you are somebody who has photosensitive skin disease like melasma or phototanning, I do advise that at least apply once. If no repeat application, at least apply once during the day. So that will provide you protection for 3 hours when there's the main household chores are going on. So, and if the patient is right now, the trend was work from home. So they are sitting continuously in front of computers and laptops. So they also emit something called blue light. So in fact, blue light would be more near to your face rather than the sun. So it is seen that even the 60-minute exposure to the laptop blue light can trigger a premature cell shrinkage, and that leads to premature aging. So sunscreens at that point, like work from home, also a sunscreen would be must, and that to reapply every 3 hours.
Okay, so now we completely understand what you're saying. So, because most of the time we are in front of our laptops or digital devices or mobile mostly, so it's important from to safeguard our skin from those harmful rays that are emitted through those gadgets or devices. So, even if you are inside, you need to apply sunscreen on a regular basis. Now, another question, as you said, at least once you need to apply if you are working indoors. But what if we have a general in general, if we talk, how many times we need to reapply sunscreen, how much amount should we use, which area should we cover? This is again a part of confusion for most of the people.
Yeah, so the amount is always a shock to my patients when I say you have to apply 3 ml for the face and neck, or 2-finger units is the new rule which the patient are better able to understand. Like you have to make 2-finger lines on your 2 fingers, that's the amount you have to apply. So they are all in shock, doctor, hum to sirf aise laga dete hain. So I always say either apply properly or completely forget to apply your sunscreen, because that dot is not going to help and it's just wasting of money applying just that dot sunscreen. So yes, 2 finger units for the face. If you are going out on a swim or a beach holiday, then it's 6 ml for the hands, 3 ml for the face and neck, and 6 ml for each leg. So it's like 1 ounce of sunscreen would be completely used if you are exposed that way. And if you are going in a pool, there's something called which is mentioned. There's something which is mentioned like water resistant.
Yes.
So some sunscreens would be 40-minute water resistant, some would be 80 minutes. So for swimming, I would recommend 80 minutes of water resistant sunscreen. So then in that case, you'll have to apply every 80 minutes. For those who are into field and sweating a lot, like the season is such, then I would recommend every 2 hourly. And if you are just sitting indoors but in front of laptops, then every 3 hours.
Okay. So this is the duration for how long we need to keep the sunscreen, when to reapply, how much to take. So we are clear about that page, at least for now. And doctor, one more thing, because we have different kind of skins. We all have different type of skins. Now, if I go for buying a sunscreen as per my skin type, what are the options that are available? So in talking in general about the people or the viewers who are watching this session right now, how to choose the right kind of sunscreen as per our skin type.
So choosing the sunscreen mode, again, we classify as like first according to occupation, like I already discussed, indoors, outdoors may field work, like that. Next, we come to the skin type. So is your skin type normal? Is your skin type oily? Is your skin type combination? Or you have sensitive skin? So for oily skin type, I prefer something which is gel-based or a mousse-based sunscreen, which don't give that sticky look to the face and doesn't add to the oiliness. For those who have normal to dry skin, anything which is cream or lotion-based would work. And for those who have sensitive skin, I recommend a physical block more than a hybrid sunscreen or an inorganic sunscreen. I would prefer something which is a physical sunscreen that would lead to less amount of stinging and redness which occurs for sensitive skin people.
Can you elaborate a little more on what's physical sunscreen?
So the classification of sunscreen goes like physical and chemical. Nowadays the term has changed. It is like organic, inorganic, and hybrid. So organic is what earlier it used to be like a physical sunscreen. So sunscreens containing zinc oxide and titanium dioxide mainly are physical sunscreens. So these sunscreens can be safely used in kids also. Those who have pigmentation issues like melasma, and for those who have sensitive skin like rosacea or sensitivity to any product. So there are no chemical ingredients in those sunscreens, just physical particles which are zinc oxide and titanium dioxide particles which create a layer on your face, doesn't seep into your skin and reflects the light. So it's good for babies above 6 months of age and for those who have sensitive skin. Now chemical sunscreen. So the side effect of physical sunscreen is that sometimes it leaves a white cast. So many times patients say you have to apply 2 finger units. You say you apply 2 finger units and we look like a ghost. So that's because of certain physical sunscreens, they have big zinc oxide particles. So nowadays that is also advanced, like nano-sized particles are available which doesn't give that white cast also. So for those who don't like the white cast and they are doing fine with the chemical sunscreen, they can use hybrid sunscreens also, which has both protection, like protection from physical as well as chemical sunscreens. So they get, I can best of both worlds without the side effect of the white cast and the protection of both chemical as well as physical sunscreens.
राइट बहुत सारे क्रिकेटर्स मुझे याद आ रहे हैं, खास तौर पे एलन डोनाल्ड है साउथ अफ्रीकन पेसर, या फिर एंड्रू साइमंस ऑस्ट्रेलिया के, उनके जो वाइट पैचेस हमें दिखते थे व्हाइल दे यूज्ड टू प्ले, आई थिंक वही फिजिकल सनस्क्रीन है जिसकी हम बात कर रहे हैं.
Absolutely.
Doctor, would also like to understand, because a lot of formulations are available these days in the market. We have gel based, we have lotion based, we have spray sunscreen. तो ये भी मतलब एक तो definitely आपने बताया, if you have oily skin, go for a gel based sunscreen. So these are there, but then there's so much of market gimmick as well. इतनी advertisements है social media पे, television पे, सब जगह, कि हम बहुत कंफ्यूज रहते हैं what to choose. So should we go for a medicated sunscreen, or should we go for a broad spectrum sunscreen, or should we actually go and consult a dermatologist like you? कि प्लीज हमें बता दीजिए क्या हमारे लिए बेस्ट होगा, क्योंकि यही एक चीज है जो हमें सबसे लंबे समय तक लगाना है अपने स्किन पर.
Yeah, so yes, it's good to consult your dermatologist at least once to understand your skin type. Many patients are not able to understand their own skin type. So according to the skin type, the doctor would prescribe you what sunscreen would suit them the best. As I said, oily skin, gel-based or mousse-based sunscreens. Those who have oily, dry skin, cream and lotion-based. Now, spray sunscreens are something which are easy to use, like especially when you're on a beach holiday or when you are out for swimming, it's easy to just spray the sunscreen. But in those because of the spray, because you have to spray 8 inches apart. So I don't personally prefer spray sunscreens, just because it's just like a more of a fashioning thing for certain patients that I am using a spray sunscreen, but I still stick to the age-old lotion-based sunscreen for the body. And yes, nowadays there are tinted sunscreens also available. So it does provide a upper edge in protection from the sun. Like tinted sunscreens are always better in terms of protection because the particles of the tint also reflect the light. So those who have melasma, those who have pigmentation, it's a good option to hide their pigmentation, so they are even more confident while going out, and also it protects better.
Fair enough. And doctor, as I said in the beginning, that a study reveals that 67% of people are still not using sunscreen, despite knowing that sunscreen is important, specifically in in the weather condition that we all Indians live in. It's extreme heat or extreme weather changes, humidity, etc. But still we have all the excuses to not use sunscreen. बहुत से लोग कंप्लेन करते हैं कि मुझे एक्ने आ जाता है सनस्क्रीन यूज करने पे, या बहुत ऑयली चेहरा लगने लगता है, या फिर बहुत डल लगने लगता है चेहरा, बहुत ज्यादा स्वेटिंग होने लगती है सनस्क्रीन यूज करके. तो वो हमारे तमाम व्यूअर्स जो अभी भी सनस्क्रीन यूज नहीं कर रहे हैं, क्योंकि ये तमाम दिक्कतें उनके साथ होती है, उनको आप क्या कहना चाहेंगे?
ये सब था पहले, लाइक कि बहुत ऑयली हो जाता था बिकॉज ऑफ द ओवर ऑयल प्रोडक्शन एंड बिकॉज द सनस्क्रीन दैट टाइम वर नॉट नॉन comedogenic and they led to acne. But now there is a good R&D department. They all are working each and every day to make better and better sunscreens which don't give that sticky feeling, still they give you a good glow. As I said, the tinted sunscreens are good for working women who have to apply makeup but don't have time, so just apply the sunscreen and they're good to go. If at all you still feel, because the season is so humid, you can just like take a compact powder and just dab it on the sunscreen, so that also would add to the protection, the powder particles, as well as it will mattify your skin. So this is something you can do extra, but nowadays you consult your doctor regarding your issues with the oiliness or the acne. Of course, he or she will prescribe your sunscreen, which you'll definitely love, because nowadays the market is flooded with really good sunscreens.
Maybe we are not using the right kind of sunscreen as per our skin type, and for that, as doctor is saying, do go and consult your doctor. They'll advise you as per your skin type or your occupational requirements.
Because it's going to be used like almost like till you want to go out in the sun. So for that you can consult your doctor, of course.
Definitely. And doctor, what should be the chronology of using sunscreen? We normally use, like, we will clean our face the first thing first to start the day. Then we don't know what to do. I mean, whether to apply the moisturizer or to apply the sunscreen. And if at all we want to use a makeup also before we go out, where does the sunscreen part should come and fit in?
Yeah, this is also something which many patients make a mistake, especially post procedure. I have patients, I ask them to apply moisturizer and then the sunscreen. They come applying sunscreen first and then the moisturizer, and whole face has gone tan. So, see, first would be cleansing, of course. Then, if there's some issues with the skin, the doctor might have prescribed you some treatment part. So it's CTM, but it would be not toner. The doctors nowadays don't recommend toner because the cleansers are so good. They are pH balanced, so you don't require toner nowadays. So cleansing, the treatment part, and then moisturize. Every skin needs a moisturizer, be it be oily, be it be dry. So there are different kind of again moisturizers available. Then top it up with your sunscreen. You can wait for in between 2 minutes for it to just soak in, so that your sunscreen don't get greasy or sticky because of the moisturizer. You can top it up with the sunscreen, and if at all you want to do makeup, you can do makeup on the sunscreen.
Right.
So sunscreen will be the last layer in your skincare regimen, but if at all you want to do makeup, you can top it up. Like on the sunscreen, you can apply your makeup. So sunscreen act as good primers also, because most of the sunscreen are silicone based and primers are full of silicone. So no need to invest in a primer before applying your makeup, because the sunscreen would act as a good primer.
ओके अच्छा, बहुत सारे मेकअप प्रोडक्ट्स भी क्लेम करते हैं कि उनमें सन प्रोटेक्शन फैक्टर है। दे क्लेम कि हमारे में 12%, 15% SPF है। तो shall we go for standalone sunscreen in that case, or ये makeup product से भी we can protect our skin?
No, all these makeup products, like in sunscreen, you have to apply 2 finger units. You don't apply 2 finger units of any makeup product. Right. So you can, as I said, you can top it up like compact powder. You can top it up on your sunscreen. That would add to your sun protection value. But standalone, any BB cream, any foundation, any compact powder which SPF 15 or so won't give you that optimum protection. So so no standalone makeup with the SPF would do.
Right.
You have to apply sunscreen.
तो अगर अभी तक आप सनस्क्रीन यूज नहीं करते हैं, प्लीज गो इन्वेस्ट इन अ गुड सनस्क्रीन व्हिच इज गुड फॉर योर स्किन एज पर योर स्किन टाइप. इफ यू आर कंफ्यूज्ड ऑन दैट पार्ट, प्लीज गो एंड कंसल्ट योर dermat, but start using sunscreen right away. It's very important. And doctor, in India, a very common skin condition is melasma or pigmentation, especially in women. For various reasons, they get those brown patches on their face or other parts of their bodies. Now the thing is, if they start using sunscreen, or if we are using sunscreen, are we going to prevent ourselves from getting hyperpigmentation or melasma?
So melasma is something which is multifactorial. So it is not just the sun which causes melasma. Many a times it is post-pregnancy. It's because of certain hormonal imbalance. It's many a times because of like many nutritional deficiencies, and of course sun is an aggravating as well as a positive factor. So the first line treatment in melasma is always a sunscreen, and specifically to prevent the relapse. Like we can all treat melasma, but it's a notorious pigmentation. It tends to come back in spite of us doing each and everything. It's like almost a gray zone for us dermats also. Like how to permanently cure melasma is still a gray zone. So we always advise the patient to at least follow a basic skincare routine, which includes a day cream, a sunscreen, and a night depigmenting cream. In which, if the patient is going out, I always say, "Bhai, kuch nahi le jana hai, sunscreen to zarur le jana saath mein." Because the moment you go out, you, of course, you are roaming around, you are into the mood of vacation, you forget to reapply your sunscreen. But at least those patients with melasma who have phototanning disorders, those who get tan easily, I advise at least use sunscreen, nothing else. Just use sunscreen and keep one in your purse so that you can reapply. Nowadays, there's stick sunscreens also available, so the ease of application also increases. So you can use something which is a stick-based sunscreen just to reapply in between.
Right. तो अपने पास हमेशा एक सनस्क्रीन जरूर रखिए, उसे रीअप्लाई करते रहिए. कई लोग जो ऑफिस जाते हैं, जिनका बहुत ही बिजी हेक्टिक स्केड्यूल होता है, दे आल्सो कंप्लेन कि हमारे पास टाइम नहीं होता सनस्क्रीन का. एक बहुत छोटी सी ट्यूब आप अपने पर्स पॉकेट में रख सकते हैं. Whenever you go to take a loo break or something, you can just go and apply sunscreen. That's as easy as sound. So please start using sunscreen. That's the bottom line. We'll also take some of the questions that our viewers are asking. Aarti Meena is here. Aarti is asking, does sunscreen prevent tanning?
So a good question, Aarti. So this was the season where everybody went out and then came back tanning. Many did apply the sunscreen religiously. So see, it doesn't protect you from tanning 100%. Of course, you will get some amount of tan because it doesn't block 100% of rays, the UVA and UVB rays. But the amount of tan you might have got from not applying any sunscreen would be, of course, much more from the tan you got from after applying sunscreen. So, of course, it's not a sure shot to prevent tanning. But, of course, the amount of tanning after a beach holiday or something would be less. But, of course, not zero.
Exactly. So definitely start using sunscreen. बाकी तो at least वो थोड़ा तो बचाएगा ही, काफी protection तो आपको देगा ही, and further skin damage से भी आपको protection देगा. पूजा पंडित पूछ रही है, how much sunscreen should I use and how often should I apply? Though we have already discussed it, but still I think Pooja has joined the session a little later to.
Yeah, so I will again reply to this important question which she asked. It's like 2 finger units. You have to make 2 lines on your fingers and then you have to just apply all over and then just spread it. Don't take your sunscreen in your hand and move like this and then apply. You're just wasting your sunscreen in your hand and almost half of it is going on your face. So take 2 finger units, you can directly apply like this and then spread it in, and you have to apply at least 2 to 3 hours if you're out throughout the day.
Right. Swati Sharma hai पूछ रही है, hello ma'am, with sunscreen SPF 15, 30 and 50 should I apply if I have dry skin?
So dry skin, that's not the factor where we decide the SPF. So dry skin, you can go for cream or lotion-based sunscreen, and SPF would again depend on what kind of work do you do. If you're into field or you are going for certain procedures like chemical peeling, lasers, where you're already going for a detan, it's better to use SPF 50 or above, or else SPF 30 would do.
Okay. Palak Dubey is asking, what about the mess made with sunscreens containing titanium and zinc oxide, especially the stains on clothing and the messy feel?
So as I said, nowadays very good physical sunscreens are available in the market, which are safe to use in kids, like Sebamed kits are available, Cetaphil kits, even Acne UV gel has an alcohol-free option for certain those who are looking for alcohol-free label on them, and there's something called Z Block, there's something called L Free. So all these are really good physical sunscreen which doesn't stain your clothes.
Okay, so go and invest in the best sunscreen that is good for your skin. Palak. Vijayta Modi is asking, I have a very busy lifestyle. मुझे system के सामने 10 बजे तक बैठना पड़ता है. मैं natural way से कैसे ध्यान रख सकती हूँ अपने skin का?
So the natural sunscreens which are available doesn't protect you totally from the rays. Like even the clothing, like if you're wearing a cotton or a linen cloth, it just blocks 5% of the UV rays. So it's not like आप कपड़ा बांध लो तो आप sun protect. मैं नहीं say कि मैं दुपट्टा बांध लिया है तो मुझे sunscreen की जरूरत नहीं है. But if it's a cotton or a linen dupatta or a short like this long full sleeve shirt, it just protects you 5% from the sun rays. So there is no shortcut or a natural way to sunscreen actually. Other DIYs are good for your detan or something, but for sunscreen I would say a big no.
Exactly. और इसी से जुड़ा हुआ क्वेश्चन जो आपने बोला भी कि DIY बहुत आप स्किन टैनिंग या दूसरी चीजों को दूर करने के लिए करते हैं, तो जो होम रेमेडीज करते हैं, especially because we have this tendency of finding a remedy related to our skin problems and to our kitchen, etc. तो वो होम रेमेडीज कितने ठीक रहते हैं? कहीं वो हमारी स्किन को किसी तरह से कोई हार्म तो नहीं पहुंचाते?
Yeah, so always don't go by the YouTube and everything. A Colgate लगा लो या lemon लगा लो. So many patients turn up with burns on their face after doing all this. So your doctors would suggest you DIYs according to your skin type. Never follow all these trends which are nowadays coming on Reels and YouTubes and Instagram. Not everything which is suiting one person would suit you. So always consult your dermat. She or he would always guide you about. I many times guide my patients about DIYs too. Nothing wrong in certain things which can be used on your face and are good for a detan or a moisturizing pack kind of thing. So something which has oats, honey, dye, all these are good for your skin. But using multani mitti, besan would further irritate if your skin is sensitive and dry.
Exactly. So even for the home remedies, you should go and consult your doctor before trying, the whole of your kitchen on your face. You may end up, harming your skin. So please go and consult your doctor. And in case you have any skin-related issues, then please don't do any over-the-counter medication, self-medication, home remedies, or going through some YouTube channel or surfing online. Just invest those time, energy, money in going and contacting a doctor. That's important. Neha Chaudhary is asking, how many times a day should I wash my face? This is again a very relevant, if not related with sunscreen directly, but then people have this notion in their head that they should keep on washing their face as many times as possible. What's the right way to do it, doctor?
So yes, so washing face twice with a cleanser is good. Overwashing your face would add on to sensitivities, irritation. Even if it's an oily skin, it would add on to the oil production, because the skin would get a response like the skin is getting dry, let's produce more oil. So to combat oiliness, your skin is creating more oil if you're keeping on washing away the oil from your face. So for very oily skin, 2 or maximum in this season, I would say 3 times a day would be okay, not more than that. For dry skin people, twice a day. Using a proper cleanser according to your skin type is also important in this. Those who are into makeup, I ask them to double cleanse in the evening to prevent the comedone and blackheads formation.
Okay. हमारे साथ मीना मिश्रा है, पूछ रही हैं, what else should I know about sunscreen and what else can I do to protect myself from the sun? तो sunscreen के अलावा भी कोई तरीका है या उसके साथ कुछ जो हम कर सकते हैं?
Yeah, so again, you have to, in spite of applying sunscreen, as I said, it's not a sure shot. It doesn't protect you 100%. So something like you can add on physically, you can use broad brimmed hat, you can use scarves, you can use gloves to add on that UPF, which is the ultraviolet protection factor from the clothing, to add on to the amount of protection you get totally, not just from sunscreen. So yes, this you can do. You can cover up.
Sunscreen तो लगाना ही है, उसके साथ आप clothing, हाँ exactly. तो सिर्फ ये सोच के स्कार्फ या हैट का इस्तेमाल मत कीजिए कि इससे आपको सनस्क्रीन लगाने से छुटकारा मिल जाएगा, ऐसा नहीं है, सनस्क्रीन तो लगाना ही है. सलोनी मिश्रा पूछ रही हैं, मैम क्या मैं ओवर द काउंटर लेकर सनस्क्रीन अप्लाई कर सकती हूँ? I have a dry skin.
So dry skin people are blessed that they don't get acne frequently, but certain sunscreens, see, sunscreen is something which I prefer you use a medicated one, because they have passed through vigorous trials. And their SPF, what they've mentioned is the actual SPF. Many times the studies have been done, especially the Korean sunscreens and all available. So there's a good brand, I won't name it, but उसका टेस्ट जब किया तो उसका SPF जब मेंशन था 50, तो वो निकला सिर्फ 18 एक्चुअल जब टेस्ट किया. So all these cosmetic brands, they don't go through vigorous trials to prove their SPF factor. So it's better to use a medicated sunscreen so that we actually know that अच्छा 50 लिखा है तो at least 40 above तो होगा.
Exactly. रजत यादव एक बहुत ही रेलेवेंट क्वेश्चन पूछ रहे हैं, मैम क्या सनस्क्रीन के साइड इफेक्ट्स होते हैं? क्योंकि सबसे लंबे समय तक हमको सनस्क्रीन ही लगाना है और सबसे ज्यादा लगाना है, तो ऐसे में इसके कोई साइड इफेक्ट्स तो नहीं है, टॉक्सिक तो नहीं है ये हमारी स्किन के लिए?
Yes. So as I said earlier, chemical sunscreens कुछ ऐसे हैं जो अब कुछ countries में ban हो गए हैं, because they are systematically absorbed from your skin and they cause hormonal side effects in your skin. Nowadays, not many sunscreen come up with those chemicals like avobenzone, oxybenzone. So ये थोड़े chemical sunscreens हैं जो जिनका sensitive skin है उसको irritate कर सकते हैं, या on longer term, because ये सब body में absorb होके disturbance करते हैं. तो जैसे मैंने बोला melasma में मैं नहीं prefer करती हूँ chemical sunscreen, because वो भी एक hormonal pigmentation है. So if you are somebody who has side effects with sunscreen, go for physical sunscreens.
Right. Parul Shinde hai. With sunscreen to choose for very sensitive skin, can I apply in the night? My age is 17 years.
So what did she ask? Which one she can apply?
With sunscreen to choose for, she has a very sensitive skin. So with sunscreen, she can choose, and can she apply it during night?
Night sunscreens are not required. Not in front of your laptops at night. Like sunscreens are not required past 5 p.m. in the evening. And for sensitive skin, as I said, zinc oxide and titanium dioxide based pure physical sunscreens are much better than the chemical sunscreens.
Okay, the Parul, you can either go for physical sunscreen or go and consult a dermatologist. तो शायद आपको पता चल जाएगा कि एग्जैक्टली आपकी सेंसिटिव स्किन है या नहीं, या क्या आपको यूज करना है। अच्छा, पारुल ने जो सवाल पूछा कि नाइट में क्या करना चाहिए, आपने बताया 5 बजे के बाद जरूरत नहीं है सनस्क्रीन लगाने की, लेकिन वो जो हमें एक स्किन केयर रूटीन बता रहे थे, उसमें अगर रात को हमें कुछ उसमें एड ऑन करना है, समथिंग दैट शुड एक्चुअली keep our skin healthy, light, and keep the cells, in a rejuvenating mode, तो हम क्या कर सकते हैं? Yes, doctor. You need to unmute yourself, doctor. We are not being able to hear your voice. So by the time we have our doctor back with us, today we are talking about sunscreen and its significance in our skincare regimen. And it's important to use sunscreen daily, reapply it, and take the sunscreen in right amount, and then apply on the areas that are exposed. Basically, so it's important to use sunscreen, use it on a regular basis. Welcome back, doctor. We have you with us again. Okay. So, we have Priyanka Joshi with us. I'll take her question first. What lifestyle changes should I do to combat acne? Now, the question is acne related. इसी में मैं एक और सवाल ऐड करना चाहूंगी। जो acne prone skin वाले लोग होते हैं, वो अक्सर कहते हैं कि सनस्क्रीन लगाने से कहीं हमारे acne और ज्यादा बढ़ ना जाए। तो अगर acne है, तो क्या वो सनस्क्रीन का यूज कर सकते हैं?
ऑफ कोर्स एक्ने है तो आप कोई भी स्किन हो आपको सनस्क्रीन यूज करना है. इट्स जस्ट चूजिंग द राइट सनस्क्रीन. So the sunscreen would have a label mentioned like non-comedogenic. So those sunscreens you can use. If your skin type is oily, go for a gel based or a mousse based sunscreen. And always, if you have acne, you must be applying some anti-acne medications. So when you are applying anti-acne medications, your skin becomes a bit sensitive, also dry. So protecting your skin from sun becomes really important in that case. So apply a gel-based or a mousse-based sunscreen, even if you have acne-prone skin. And regarding lifestyle modification for acne, it would be like stop dairy products. Many moms make a face when I ask them to stop dairy products. But see, milk nowadays is really adulterated with all hormones and antibiotics given to cow to continuously produce the milk, which is in a high demand, and the amount of cows producing milk is really low. So they are giving continuously hormones and antibiotics to keep the production on, and that is going in our body and creating a mess. So, and also milk per se, which has lactogen and lactulose, is very inflammatory to the gut. So there's something called a gut skin axis in acne, which directly relates to the skin health and the probiome which is present on the face. So I advise the patient not to take dairy, not to have too much of sugar in their diet. Try to avoid junk as much as possible and sleep. So nowadays the lifestyle is such that many stay awake without any reason till 1 and 2 p.m.
but that is not good for your skin. There's something called a stress hormone, which gets released if you are staying awake past 12. So if you follow these three things like diet, exercise, and sleep, so at least the new occurrence of acne would get less. I would say not completely stop, because that's a like a teenage thing, like you pass through that acne phase because of the hormonal changes. But this is more important in those who have adult acne, like in spite of crossing their teens, they still keep on getting acne, either because of the wrong product application, either because of the lifestyle, either because of hormone imbalance. So do consult your dermatologist if you're still suffering from acne, because in acne, again, we say prevention is better than cure, because once the acne forms scars, so scars can't be treated with just tubes. Then you'll have to go into lasers and MNRF and everything just to get rid of those scars.
Right. So prevention is always better than cure. So please prevent your skin from acne, from other skin related issues, and from sun damage. And for that, you need to use a sunscreen. Now, Dr. Namrata, as we are moving towards the conclusion part of the session, any takeaway message for our viewers?
Yeah, so be it be cloudy, be it be winters, be it be sunny, don't forget your sunscreen if you want to reduce your visits to your dermat and expenses into depigmenting creams and anti-aging procedures. Do apply sunscreen regularly. Choose the right sunscreen. Go to your dermat once. Get the right sunscreen for you, and of course, you will see that your visits to your dermat would definitely reduce after following a good regime in the day and night.
That was very informative. Thank you so very much, Dr. Namrata, for your valuable time, and it has been a very informative session for our viewers. It was great to hear from you. Thank you.
Okay. Take care, everybody. Bye-bye.
Thank you, and we really look forward for many more such sessions for our viewers in coming times.
It was a fun session, and there were so many good questions which came up. I really enjoyed answering them.
Yeah, and for that, I would like to thank our viewers as well for your active participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.
Bye-bye.